Hundreds of Sydney residents have been told they're actually positive for COVID after being caught up in the latest testing bungle. Julia Bradley is live in Sydney this afternoon. Julia, the pathology responsible just confirmed the results.
That's exactly right, Julie. We've seen a statement being issued just in the last few hours from SydPath, which is the private pathology operated by St Vincent's Hospital here in New South Wales. And they have confirmed that 950 people have been caught up in this latest COVID testing blunder. Now, what has happened is that all of these 950 people, they were all sent a text message on Boxing Day telling them that they were negative for COVID-19, when in fact about half of them were positive for the virus. So there are concerns among some health experts that up to 1,000 Sydney residents could have been exposed to the virus because hundreds of these people could have been out and infectious in the community. Now, part of that statement reads, once again, we are sincerely sorry for this error and acknowledge the significant impact it has had on those involved. It says, in order to maintain the quality of our testing, we are reducing the number of COVID tests we process to ensure the volume remains within our capacity. That pathology confirming that it will no longer be doing testing for interstate travel on a temporary basis until they're able to get through that demand. And we've also heard from the New South Wales Premier, who has spoken about some of the pressure this has put on our health system.
Continue to have strong and constructive discussions with my interstate counterparts, the premiers in other states, in relation to this tourist testing, and continue to ask that it be removed. I want to thank Stephen Marshall for removing that test. It is clogging up the system. It is putting people in lengthy queues that are not necessary.
This follows another blunder involving the same pathology at the weekend. More than 400 people were told they were negative for the virus when they were in fact positive. And it is partly being blamed on the sheer demand for testing that clinics are experiencing right across New South Wales. Here we're just above a major testing clinic on Epping Road, and as you can see, cars are banked up for several hundred metres. This is one of the only clinics in the area that is open throughout the afternoon, so you can see plenty of demand here for swabs, and it is likely that those queues will continue right up until closing. We spoke to some people this morning who'd been waiting more than 3 hours for a test. Waiting.
Well, they said they'd open from 8 till 12 in the morning. I got here about 7:45, and it's now 11:24. I'm just glad I made it, to be honest.
This is the second clinic we've been at. We got to the one in Rozelle at 8:15, and we were on the queue for half an hour, and then they told us it was closed. And my mum's been locked out of Queensland since June. I'm just trying to get her home. I'm going to drive her home because she's too scared to catch the plane. So it's a bit frustrating. The man told us in the queue about...
How long have you been waiting for a test today?
2 hours. 2 hours.
Did you expect it to be that long?
I did, because it's my third one.
Yeah, scenes like that right across Sydney at the moment. Julia, new isolation rules have also come into effect for healthcare workers.
That's right, Julie, and that's to alleviate some of the pressure on our health system. So as of today, those health workers who are considered close contacts of a positive case, they'll only are required to isolate for 7 days. That's down from 14 days, but they'll be required to get a PCR test on day 6 of their isolation period, and that will have to come back negative. And from that point onwards, they'll then have to get daily rapid tests to check that they aren't positive for COVID as they head back to work. And this comes as the new figures for COVID in New South Wales are released today, 6,062 new local cases. Thankfully, though, no dramatic increases to the hospitalisations or the ICU admissions as well, Julie.
Julia Bradley live in Sydney for us this afternoon. Thank you for the update.